What imaging is best for atypical stroke diagnosis? When it comes to diagnosing atypical strokes, you might wonder which imaging method is the most effective. Atypical strokes can present with unusual symptoms, making accurate diagnosis crucial. The best imaging technique for this purpose is magnetic resonance imaging, particularly diffusion-weighted imaging. This method is highly sensitive and specific for detecting ischemic brain injuries, even when the symptoms are subtle or atypical. Magnetic resonance imaging provides detailed images of brain tissue changes. It can identify small or early infarcts that might be missed by other imaging techniques. This is especially important for atypical presentations, where symptoms may not align with classic stroke signs. MRI helps differentiate stroke mimics, which are conditions that can resemble a stroke but are not strokes, from actual strokes. In acute stroke situations, computed tomography, especially non-contrast computed tomography, is often the first imaging choice. It is widely available and quick, making it excellent for ruling out intracranial hemorrhage. This is critical in the early management of strokes. However, while computed tomography is good for this initial assessment, it is less sensitive than magnetic resonance imaging for detecting early ischemic changes or small infarcts, which are often present in atypical cases. Additional computed tomography techniques, like computed tomography angiography and computed tomography perfusion, can provide valuable insights into blood vessel conditions and the extent of salvageable brain tissue. However, these methods alone may not be sufficient for diagnosing atypical strokes without confirmation from magnetic resonance imaging. Magnetic resonance angiography complements magnetic resonance imaging by evaluating blood vessels non-invasively. This can help identify vascular abnormalities that may be contributing to atypical stroke symptoms. In summary, while non-contrast computed tomography is the standard initial imaging to quickly rule out hemorrhage, magnetic resonance imaging with diffusion-weighted sequences is the best choice for confirming atypical stroke diagnoses. This method excels in detecting ischemic injury and characterizing brain tissue in detail. Other computed tomography techniques can assist in vascular assessment and treatment planning but should not replace magnetic resonance imaging in atypical cases. This imaging approach aligns with current stroke diagnostic protocols, emphasizing the importance of rapid hemorrhage exclusion and thorough ischemia assessment to ensure accurate diagnosis and appropriate management of atypical stroke presentations. Always consult healthcare professionals for personalized medical advice.